All right, thank you for giving me the chance to speak. Before I start, I do want to just caution us as a community from using words like champion and immigration in the same sentence when we're in a space where undocumented people cannot be, especially when this immigration has had a mixed record on many of us who are doing immigration advocacy outside of the HIV and with the HIV space. But my name is Sarah Audelo, and I'm the Senior Domestic Policy Manager at Advocates for Youth, an organization that focuses on the sexual and reproductive health and rights of young people, both domestically and internationally. Reflecting back to the last PACHA meeting on young people, there were a few areas that both our activists Sade and Lawrence highlighted as important, but also some areas for growth within the administration that I'd like to bring up. First, as Jen from SECUS will focus more on tomorrow, the Division of Adolescent School Health received a devastating 25% cut in fiscal year 2012 budget. Dash money funds vital work with state, local, tribal education agencies, and cuts to this funding means there's less resources for teacher training, programming, and staff time dedicated to pushing school districts, for example, to use evidence-based sex education or implementing the Youth Risk Behavior Surveillance Survey. Organizations have worked incredibly hard to get the same sexual orientation questions asked across jurisdictions and are currently working on gender identity and expression questions. Already this population is so small, we're concerned if DASH staff are not able to push districts to implement the YRBS, we will not have the weighted data we need, not only on LGBT youth, but on youth broadly in areas such as sexual health, but also tobacco use, violence, etc. It was heartening that the President requested DASH's funding be restored to almost fiscal 2011 levels, but the reality is DASH funding hasn't been increased in years, and already people on the ground are doing more with less. While it should be obvious that the health and education people need to work together, unfortunately the reality is too often they don't, and we need PACHA to be a champion for DASH, and like I said, you'll hear more about that from Jen tomorrow. In addition, while DASH is doing great work, the fact remains that the Department of Education's lack of involvement on HIV and AIDS, because this so-called controversial issue for them, it means fewer young people, educators, and administrative staff are being engaged in this work. Ed must be at the table for a variety of reasons. First, teachers must be engaged and taught not to discriminate against our positive youth, as Lawrence described from his personal experience at the last meeting. While there is emphasis on the 4 core subject areas, health must be included not only to teach our young people about making healthy decisions for themselves, but health education can also be a tool used to create safer spaces for our LGBT young people. The Safe and Healthy Schools programming Ed engages in is great, but safe and healthy schools must be inclusive of sexual health as well. And because data shows the only increase in HIV incidence between 2006 and 2009 was in young MSM, and in particular, young Black MSM, we have to get more creative and engage more partners in this work, no matter how controversial this issue may seem. This means having Ed at the table, but also ensuring that we're keeping track of where our prevention dollars are going. That includes disaggregating prevention dollar data by age, which unfortunately, what we heard at the last PACHA meeting on youth, is not happening in many of the sub-agencies. This also means looking at sex education funding that's going out the door, such as the Teen Pregnancy Prevention Initiative, and making sure these programs are inclusive of HIV. If young people make up 1/3 of all new infections, we need to make sure funding is targeting this population and the issue, especially for those most at risk. And finally, as Sade and Lawrence mentioned at the last PACHA meeting, young people must be represented within PACHA. Sade and Lawrence are only a small representation of the amazing generation that is working at the forefront of prevention, treatment, and care for youth, and advocating both for themselves and their communities. They are experts, and as experts should also have a seat at the PACHA table.
Thank you very much.
Thank you.